What is the way that you think is the best way to approach Lyme disease?
Actually, this is a difficult question. It's
I know.
not a one-word answer on that. Initially, I do go with the standard guidelines. If it's uncomplicated, early the diagnosis, I will treat them with a course of doxycycline. But I would say I might have had just like a 1% success on that. A lot of these patients will recur and or relapse, and they could have then much more severe symptoms.
And we're talking about the IDSA guidelines, the
Exactly.
regular ones. Like, what is it? Doxycycline for how long?
I will give them doxycycline for 2 to 4 weeks. If there's a history of recent tick bite, or it's an initial patient and has never had treatment. And once, unless there's a neurological symptom, they have headaches or meningeal symptoms, then I would right away start them on IV receptor.
Okay.
But a lot of times, by the time I get the patients, they've already done the oral treatment and are persisting with the symptoms. So I usually end up starting them on IV receptor.
Okay.
In my practice, I have seen the best results with intravenous receptor. The only thing is the IDSA guidelines again is 6 to 12 weeks, and a lot of times patient does not fall into the IDSA guidelines, and so a lot of times the treatment is directed towards the patients, and the body does not know what a textbook says.
Yeah, but what happens in that case that you're saying the person does not respond to the 6 week? It means the person is getting better and then they get sicker again?
Well, what these patients do, that could be one scenario. They get better and then they're getting sicker, and then you have to play with the dosing. Or there could be co-infections making it worse. So I look for other co-infections making it worse, or whether it's the patient's own body. But also sometimes what they do is they initially get the Hexheimer reaction and they start getting better, but they're not better enough. And if you follow their blood work, it can be literally documented how you see 5 bands come to 3 bands, come to 1 band, and now they're stuck at 1 band. But oops, the time is up. But you cannot say, oops, the time is up. You got to treat a patient for whatever time.
So you continue.
Yeah, and you will see that some people, depending on every patient's own immune system, will take longer and get better. But if you stop them at that 1 band because the time is up as per the IDSA guidelines, those patients will relapse. The next time they come in, they'll have probably 2 or 3. And if you don't pick up treatment again, they will, continue to get worse and then become full-blown. And then it's starting from square one again,
And the body's weaker.
Yeah. Body's weaker, more organs are damaged.
And also those guidelines that we as patients will also think they're not working. Do they help you address co-infections that you were talking about, parasitic infections also, or the guidelines don't give you any tool for that?
Yeah, see, the guidelines are not addressing any of the other co-infections and the other complications, but the insurance companies then stick to those guidelines. And, they'll deny patients treatment, they deny knee payments, and, it's hard to treat with the other social environment kind of issues.